U.S. continues to see alarming new levels of coronavirus cases. According to Johns Hopkins University, the U.S. now has more than 2.3 million infections with more than 120,000 deaths. Later this morning, the Senate Health, Education, Labor, and Pensions Committee will hold a hearing about the lessons learned during this outbreak in service of preparing for the next one. Joining us ahead of that hearing is Senator Lamar Alexander. He is the chairman of the Senate Health Committee. Senator, good morning. Not the best of terms to be sitting down and going through all of these things, but I guess it is very important to try and figure out what we've done wrong this time around to prevent that from happening next time. What have you learned so far? What are you seeing?
Well, what we've learned is that we need to focus on tests, treatments, and vaccines. Doing a pretty good job of that right now. I mean, they're coming faster than we ever had before. But what we're trying to do this morning is say, what have we learned that we can do to prevent the next pandemic? So tests, treatments, and vaccines. What about our stockpiles? Are we ready for surges of patients in the hospitals? How do we strengthen our state and local public health system? And then who's on the flagpole? I mean, who's in charge? Is there any way to have a supreme allied commander whenever these pandemics arrive? We know they're coming. We just don't know when.
It seems that the federal government kind of let a lot of things slide. There have been times in the past where we've been concerned about this. I know President George W. Bush, was very focused on this and concerned about it. But I guess it's hard to continue to allocate money as years go by when these outbreaks don't come. How do you think we should be thinking about these things? And we don't always know where the next one's going to be coming from. So what's the best way to kind of set up a process for dealing with that?
Well, that's why I think we should do it now while the iron's hot. I think we should pass this year whatever we need to do, for example, to accelerate the treatment of tests, treatments, and vaccines. The fact of the matter was this virus surprised even the experts. March the 1st, 6 weeks after we knew about it, the New York Times wrote, most experts think we're as well prepared as any country to deal with it. Most experts think it's unlikely to reach most parts of the country at the same time. We underestimated it. So the thing to do is to do it now, to make the decisions now about surges, stockpiles, leadership, tests, treatments, and vaccines. We have a very fleeting memory in this country. We go from one crisis to the next. If you'll remember, 4 months ago, we're in the midst of an impeachment. Now it seems like ancient Roman history. This will pass too, and now's the time to deal with it.
What do you think happened? Was it we weren't allocating enough money for these situations? We didn't have someone in charge who was supposed to be leading up the command on all of this? We let things, I guess, fall by the wayside at the CDC. Where do you look back and say, I wish we would have done this differently?
Well, it's not so much hindsight. I think this is just a new virus. I think the experts were surprised by how contagious it is and how it travels silently without symptoms. As Dr. Fauci said, it's his worst nightmare. No one expected anything quite like this. I mean, the last 4 presidents and several Congresses have passed 9 major laws doing everything from building manufacturing plants to putting somebody in charge in the Department of Health to creating stockpiles, all these things. What we need to look at today is what could we do better, even for the kind of virus that might surprise us like this one did.
We have been talking a lot over the in recent weeks about what comes next in terms of additional spending to deal with this pandemic while it's still here. We have seen a lot of spending that's been put into place, but obviously there are businesses that have been shut down for incredibly long periods of time, people who have lost their jobs, and you don't know if those jobs are going to be coming back, states and municipalities that have suffered from a loss of tax income. What do you think needs to be done next? The president has talked about potentially a $2 trillion plan. That's been what's been reported. Would you be in favor of that?
Well, I'd be in favor of 2 things. One is anything that we can do to accelerate tests, treatments, and vaccines. Spending $1 trillion isn't all the problem. This isn't an economic problem. This is a disease problem. And as soon as we have a treatment so people know that they're not likely to die or that they'll recover faster, those should come this fall. As soon as we have hundreds of millions of vaccines, those hopefully will come at the first of the year. Things will begin to get back to normal. So anything that has to do with tests, treatments, and vaccines. Second thing we should do now is make sure that our schools, there are 130,000 of them, public and private, and our colleges, there are about 6,000 of those, that they have the money they need to open safely in the fall. I mean, the surest step back toward normalcy in our country is when 70, 75 million college and high school and elementary school students go back to school. They need to go back. Their parents need for them to go back, and the economy needs for them to go back. So if we need more money for that, I'm for that.
That's pretty tall order, because I think of some of the schools in places like New York and New Jersey where the states have not gotten the income that's been coming in. There is going to be a crunch probably in lots of states at that point. Would you be an advocate for federal spending to try and beef up the school preparation for those things? It could mean some pretty extreme steps, particularly if you're trying to set up classrooms that can provide social distancing at that point.
Well, the answer is yes to your question. I mean, the school administration estimated that it would take $50 to $75 billion to properly equip the 100,000 public schools with extra money for busing that's caused by the new schedules, protective equipment, testing, any other thing. So we should spend that money for schools and for colleges. Actually, schools and colleges ought to be able to be among the safest little communities in our country. I mean, what you have to do to manage this disease, we know. Distance, masks are two of the things that you have to do, and washing your hands. And in colleges, there's a lot of room in most colleges because they don't teach in the morning or at night or on Saturday or on Sunday. And they can have smaller classes, spread things out. You can wear masks, you can wash your hands, and young people are much less affected by COVID-19 than older people. So colleges and schools should be among the safest places to go. And when we go back to college and we go back to school, the country will begin to move back toward normalcy.